Late Night Health continues. I'm Mark Alyn. During the second half of this hour, we're going to be talking about snoring. And I got rudely awoken the other night from making noise through my nose. Does that happen to you, Daryl?
No, it's the other way around.
Oh, yeah?
Yeah. No, I don't necessarily, but...
oh, my goodness.
Yeah, it's coming from the other side of the room.
Gotcha. Yeah, I got payback the other day and got to do that myself. Anyway, that'll happen about a half hour from now. I'm not exactly sure how this next 20 minutes or so is going to go. I'm really excited about it because my guest is Maria Dorfner. She is a former producer at Good Morning America. She's a health reporter, a health host. She's hosted things other than health, and we have known each other for almost 20 years now.
So you're saying she knows how this is actually supposed to work?
She actually wrote not only my questions down, but her responses.
Oh, good.
So the only thing I can do is not ask these questions.
Yeah,
you know that.
Point and shoot. Yeah.
Right? Exactly. Maria, welcome to Late Night Health. Welcome back.
Thank you. It's always a pleasure, Mark.
And by the way, I've always said to Maria that she and I would make a great on-air cute couple. Oh, well. Here we go.
The Mark and Maria show.
The Mark and or the Maria and Mark show. I don't mind taking...
Maria and Mark. There you go.
Yeah.
Chivalry is not dead.
Right, exactly. What is the state of health right now, do you think? I mean, we've been talking about a variety of different things already on the show today, from addiction to prescription drugs to an integrative approach to healthcare that seems to work. I've been reading your blogs for a long time. You seem to be involved and interested, at least, in an integrative approach to healthcare. Is that the way we should be going, should be heading?
I think the way that we should be heading in the future for health is taking more personal responsibility for our own health.
Aha. Yes, I agree.
Right now, people, when we talk about health, we're talking about insurance. Everyone's concerned about health insurance. But basically, you can ensure your health by doing the right things and being proactive. So I'm a strong advocate for taking care of yourself. My mom and dad used to say, don't get sick. The doctors will kill you.
Yeah, I've heard that before. I probably have said it. But at the same time, we still need some kind of health care, don't we? I mean, insurance?
Oh, absolutely. I mean, my feeling, emergency care, and absolutely we do.
The other day, yesterday, I was on the web and there was a survey. And it said, should obesity be considered a health issue? Should it be covered by insurance? And the respondents were 76% of the people, maybe 79% of the people said, yes, it should be, because obesity is a disease. Yes, it starts with a lack of self-control. I guess my point is that I think obesity is a disease. And I think that people who are vastly overweight need professional help, probably both psychological and medical. You don't want to drop 150 pounds in 2 weeks. You'll drop dead. What do you think?
I think 69% of Americans are obese today, and that's a lot. And I think a lot of it has to do with portion control. There are a few people that genetics, and no matter what they do, cannot lose the weight. But I think most people can. And they need to make a lifestyle change. So, I don't know, looking to the government for that, it's kind of rubs me the wrong way.
But it's not looking to the government. It's looking to your insurance company that you've been paying often for years and years and years. Even when you're older and on Medicare, you've been paying into that system. And why you should say, well, you're fat, you better take care of it yourself, that rubs me the wrong way.
Well, sure. one of the things I've always said is, why doesn't, health insurance cover gym membership and things that make people healthy?
Aha. Absolutely. Like
$30 a month.
Right.
You pay into insurance, absolutely. But are we talking about, getting your stomach stapled or some kind of intervention? The lifestyle changes still need to make place, even if your insurance covers some kind of bypass surgery or any other weight loss surgery. The lifestyle changes cannot be made by your insurance.
No.
So, again, I go back to personal responsibility still has to come first. And
I don't disagree with you. I don't disagree with you.
A nutritionist, I think that would be a great thing for insurance to cover to help with obesity. A nutritionist to educate people on, they say the Academy of Nutrition and Dietetics says 90% of Americans know that diet and exercise is important, but half of them don't understand how it works, how to achieve a balanced diet.
Absolutely, because their idea of dinner is dinner at a fast food place, with a Diet Coke. I never understood Diet Coke and chocolate cake. It doesn't make sense to me, right?
Sugar. You may as well as get an intravenous sugar.
Yeah, exactly. It doesn't make sense. Also, compliance, and I've mentioned that today as well. The studies indicate, in talking to doctors, that 50% or less don't follow the advice of any healthcare professional. It doesn't matter if it's a alternative or an MD.
Oh, is that right?
50% of the people are given a drug, are given an alternative supplement, are given exercise, are given lifestyle changes, and they don't do it. Not because they don't want to, but because the emotional upheaval to that to do that change is just too much for them.
Well, interestingly enough, I read something yesterday, I believe it was USA Today, it was a little blurb that said that if your why is strong enough, you are more likely to get results than if you're just following some kind of, cut calories and do this and do that my
Right.
doctor told me to do. You need a strong why. So that,
I don't want to drop dead.
There you go. That's a great one.
I think
There
that
you
would
go.
be one right there. And I mean, along with obesity, there's high blood pressure, there's, cholesterol. Cholesterol to me is still indicative of potential problems. They still haven't 100% tied that to heart disease, but high blood pressure has been. And I think that and stroke. And people need help. There are physical reasons to take a high blood pressure, a blood pressure lowering medication. And if there's a physical problem with the heart, because you don't want a valve to blow, for example, right? Mm-hmm. So, but at the same time, exercise, proper diet, those things can help. Most people don't eat as well as you do. I mean, you know how to eat well. Your family, we've talked, you come from a family of foodies. So my point is that knowing what to eat is difficult for many, many people who are not educated. You're an educated woman. The average person functions at a 7th or 8th grade level. That was nutrition in middle school, and we had these wonderful sweet rolls that were terrible for you, right?
Right.
And so my question is, what can we do to motivate somebody to drop those pounds, as just one example, to get healthy?
I don't think I think people need to be self-motivated, and one of the strongest things that they could know is that it's 80% nutrition, 20% physical activity. So think about that. 80% of what you eat is more important than going to the gym or exercising or a fitness routine. And there's people that, think, I can't do this. They'll go to the gym one day, they're ache, like, I want a piece of cake. And it's the cake.
Right.
Stop
or eat
eating
the whole
cake,
or just
and
have
you
one
won't even have to go to the gym.
or just have one slice of the cake and not the whole 14-pound cake.
Yes. I mean, moderation. And the Department of Health and Human Services says that 75 minutes of vigorous activity a week will keep you healthy. So that's not a lot.
Just a little over an hour.
Minutes, or 150 minutes of moderate aerobic activity, and that's a week.
Well, we're having a lot of aerobic activity now with Maria Dorfner. She is a health reporter. We'll be talking with her more. We're going to take some time out. When we come back, we'll continue our conversation. A little bit later on, we're going to be talking with Dr. Martha Cortez, a dentist who specializes in sleep apnea and other sleep issues. We'll find out more about that coming up. Late Night Health continues. Join us at latenighthealth.com, and we'll tell you more about Maria in just a little bit as well as Late Night Health continues.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate a lower tax bill. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will fight for you using industry secrets that can stop any IRS actions, eliminate penalties and interest, and reduce your past tax bill so you pay the IRS less. If you owe $10,000 or more in back taxes, call the Tax Doctor now for a free IRS audit emergency review.
800-663-5107. 800-663-5107. 800-663-5107. That's 800-663-5107.